Then the connection here is understanding the question is not why the addiction, right? Not why the cutting, why the high risk behavior or anything else, but why the pain. And when we look at adverse childhood experiences, there's a significant correlation between childhood adversity and later life health outcomes, as I mentioned, but also addictions. So there's ACES account for half to 2/3 of all serious substance use. There's a 500% increase in adult alcoholism directly related to adverse childhood experiences. So 2/3 of all alcoholism can be attributed to adverse childhood experiences. And we need to address the trauma along with it, because if we're not treating the trauma, we're not treating what's driving the need to use or binge or cut or purge or whatever it is. A male child with an ACE score of 6 has a 4,600% increase that they'll become an IV drug user in later life, a 78% increase of drug injection for women, attributed to adverse childhood experiences. And these relationships at an epidemiological level are very rare, very uncommon, right? This is something we can treat and we can do something about, and we know there's a relationship between the two. This just looks at delayed effects. So we also know there's a delayed onset of symptoms. So there's what's considered to be a 9-year delayed onset. It's just basically growth and maturation in the brain. And so there's a bit of a silent period where we don't necessarily see the impact of adversity right away. We may see that kind of 9-year delayed onset. The greatest rates of maltreatment happen 0 to 3 years of age, our greatest time of vulnerability as well. So we see those symptoms often emerging around 9 to 12 years of age while the brain is reorganizing, pruning away unused connections, and then we start seeing symptoms coming up. And this just looks at the correlation between drug use and the experience of physical and or sexual abuse versus no abuse, and also the age that people start using drugs or alcohol. So you see it's much earlier for populations who have experienced trauma, and the addiction potential is much higher. The earlier we start using drugs or alcohol, the greater the addiction potential is. And then binge drinking, there's a direct correlation between the amount of maltreatment and the amount of abuse that's experienced. So when we look at the neurobiology, some of the things that are happening in the brain is we know we have dopamine, there are pleasurable feelings that link up in the brain in association. And he really, the Bourmete, I love this quote from him. He says, the reality is addictions, regardless of the form they take, always result from pain, conscious or unconscious, with the addiction serving as the emotional anesthetic, right? It is serving a function. And he goes on to say that substances are not actually addictive without the trauma. And we look at this, if you look even at Indigenous communities, right? There are a lot of traditional practices, traditional medicines, right? That have been used holistically without addiction. We see substances used in hospitals, right? Opioids for pain reduction. There's all kinds of things that have been used by different cultures medicinally. It's the trauma that creates that addiction relationship and that addiction potential. So we have the hippocampus that forms memories between those high drug cue associations and the experience. There's an excitatory response in the prefrontal cortex of the brain, and that's how that high cue drug association becomes formed. When we come back to the purpose of what we're using, quite often what's happening is there's physical and emotional pain relief that's occurring, right? And it's serving as almost an emotional anesthetic. But there also is a blunting with our reward system. And I think I have that on a slide that's coming up. When it comes to love, connection, attachment, attunement, all of this stuff links up with dopamine and produces dopamine. All drugs of abuse increase dopamine. Lack of attachment, connection, attunement decreases dopamine. So again, not overly surprising that we see that connection. There are reduced rewards experienced when somebody has experienced trauma. So they need a higher amplitude of things to create a reward response. So if you have somebody who's experiencing, you know, hypoarousal, they're dissociative, they're shut down, they don't feel something like crystal meth, which is a horrible, horrible drug, and it just destroys lives. but gives a sense of vitality, a sense of aliveness, right? Heroin, people will often say, feels like a warm, soft hug. So okay, so developmental stress, this links back to childhood trauma, right? And the impact that it has on the brain. Like I said, pain in life is inevitable. We know we experience pain, but when we have those connective relationships, it helps us to navigate those situations differently. When we don't have those connective relationships, there's an emotional blunting and shutting down and kind of numbing that happens. And that's part of what ties in with our reward system not quite getting the same benefits from rewards that somebody who hasn't experienced trauma would have. And ultimately what we know, we talked a little bit about dopamine, and at a simplistic level, there are studies that have been done. Michael Meany out of McGill University has done some work with rat pups that won him a Nobel Prize. And what they found is that if they knocked out the dopamine receptors, amongst other studies, out of these rats, and they put food just outside of their reach, right? Just outside of their reach, they would literally starve to death, because without the dopamine, we don't have the drive, right? We need dopamine. So there's a reason that people struggle and get stuck kind of in spots where they can't get out of, even though they really, really desperately want to, because that dopamine is depleted. Relationships, attachment, attunement has actually been found to work on repairing those attachment structures in the brain, which is really cool. With alcohol and drugs, by the way, there's something that happens. It's called dopamine dumping. So there is dopamine that is experienced, but it's like, you know, if you're using alcohol or drugs, you get this like dumping of dopamine, and then it goes away and you notice the absence, which is part of what makes it addictive. Whereas if we have connective relationships and we're doing something that feels good, or we're engaging in self-care, we're dripping that dopamine. And that's what we want to do. We want to be dripping it. So we're getting those consistent little doses of dopamine, and we're not experiencing this big kind of withdrawal or pendulum shift when it's not there. So that's definitely part of the goal. Again, all drugs of abuse elevate dopamine levels, so I don't think it's overly surprising that we see addiction happening with attachment trauma and childhood trauma. Again, when we look at addictions, I mentioned adolescence is the most vulnerable period for addictions, and I really want to highlight this. There's variability between different drug classes, but basically what's happening is this is a period of vitality, right? Everything's new, and there's a reason we look back on adolescence and it's clearer, right? There's a lot of new things we experience, so the brain perks up and pays attention when something new happens. But there's also research that shows us that because of that kind of sense of vitality and the brain perking up and paying attention, there's cues that are formed that are really powerful. And the earlier I learned that this is something that serves as an emotional anesthetic, and it's you know, serving a purpose for me, the more likely I am to be returning back to it. So the stats show us that earlier drug use increases the relative dependence for lifelong addiction. People who start using younger have a much higher likelihood of remaining addicted to substances over time. And there's an increased risk for elevation of drugs, because, you know, we start out maybe with a drug, a gateway drug that's seemingly innocuous, and then eventually we build a tolerance to that. We're not getting the same benefit from it, so we move to something that gives us a little bit of a different response and build a tolerance to that. And, you know, it just continues to progress to more different substances. The relative risk for cocaine dependence after initial exposure is fourfold the risk of use before 12 years of age, and it declines dramatically with each year of abstinence. So the older we are when we use these substances, still highly addictive, but the older we are, the less likely we are to become addicted more quickly. And enduring risks of marijuana, tobacco, and inhalant use is also increased if use occurs during adolescence. So once formed, these associations, these high Q drug context associations in the brain are more resistant to extinction than when they occur in adulthood. And just recapping again the neurobiology of trauma and addictions and how this relates back to attachment, that we know that parental nurturing actually determines levels of essential and harmful brain chemicals. So we talked a little bit about dopamine, but there's also serotonin, and oxytocin is kind of that love chemical that's released, cortisol, And what we know is that these are directly influenced by caregiver-child relationships. So, and have a direct impact on attachment and attunement. Co-regulation between others, which is what is happening in the therapeutic setting, by the way, right? Co-regulation has actually been found, and that tuned connective presence has been found to repair the attachment structures in individuals' brains, which is really, really powerful, right? So the work you guys are doing is so important. I can't emphasize that enough. And that co-regulation stimulates the part of the brain that's responsible for self-regulation and also regulation of arousal, and that's the orbital frontal cortex. This part of the brain is also centrally involved with impulse control, evaluating consequences in relation to decisions, controlling cravings, pain relief, and rewards, and self-regulation. So again, when we wonder why people struggle with these areas, it's not a mystery if you understand a little bit about the neurobiology of the brain. It makes really good sense, actually, because this is the part of the brain that's impacted. So, and imaging studies actually consistently show us that the orbital frontal cortex works differently in substance users. There are changes in blood flow, energy use and activation. So the way the brain activates and the way it responds. Healthy attachment, healthy attunement has a positive correlation with the development of the orbital frontal cortex, promoting resilience, promoting optimal development. And when we don't have that, we seek it, right? We seek it, of course we do, because we're born primed for connection, attachment, attunement. It's human nature to want to be seen, heard, supported, safe. That makes good sense. When we look a little bit at the function of drugs, I just want to kind of highlight some of the things. So there's information here. Depressants result in behavioral sedation. So if we look at the window of tolerance lens that I often teach through and that we teach clients, when we're stuck on and our system is revving high, we often will see people gravitating towards depressants. But if they go too low down, right, they'll use a stimulant to bring that arousal up. And what they're trying to do is get back to that state where they feel okay, right? If somebody's emotionally dead inside, they feel numb, they feel shut down, they're often going to gravitate to a stimulant. But if they go too high up, they might use a depressant to level out. They don't know they're doing this. Like, it's not a conscious thing. They just don't feel good. And they're trying to get to a state where they feel better, right? And not surprisingly, you know, a lot of clients will talk about things like drinking to a point of unconsciousness so they don't have to feel or they don't have to have bad dreams. Or people will say, well, you know, heroin felt like that, a warm, soft hug, which from an attachment perspective is often the very thing that a lot of our clients have never had without strings or boundary violations or hurts associated with it. You know, the ADHD, if our brain is kind of revving high, again, those depressants will help to increase focus, or the alcohol may make the anxiety that I'm feeling more kind of manageable and reduce my inhibition. So again, not something that I'm promoting, but we want to understand it. We want to understand, we call it a false refuge. It gives the illusion of helping. When really, you know, it doesn't actually treat the underlying problem. It actually amplifies and exacerbates it. And then, you know, the original problem's still there. So working as an addictions counselor, I had a lot of clients that when they started to become sober, they would say to me, oh my gosh, I'm so much worse. Stopping using drugs made me worse, or stopping drinking made me worse. And I said, yes, that's what you think. That's what your brain's telling you. But really, has anybody here gone on vacation and gotten sick afterwards? Right? Like, our nervous system, we're so go, 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 some of us, that we get vacation and our body's like, and then we get sick, we get a cold or we get something else. And a lot of times that's happening because we're treading water, right? Just trying to stay afloat, and our body can't really show us, or we're not able to pay attention to those symptoms that are there beneath the surface. And we give rest, which we need for survival and renewal. Then our body's like, oh, here, pay attention to this. Pay attention to this too. It's kind of like that with addictions, right? We're using these substances, it's masking our mental health, but it's also amplifying it at the same time, because we know there's this amplifying effect where it's actually making our addictions worse. It seems like it's making it better because we're not feeling it, because we're not, you know, embodying those feelings. but it's actually amplifying it. So when we stop using those substances, they feel so much worse than maybe they did 15 years ago when I first started drinking or using drugs. And that's a big challenge, right? And also a big challenge that often will lead people to relapse because now I feel worse, right? We see this in trauma processing as well. We have a lot of people who start therapy with us, they're not in their bodies, they're not feeling their feelings. We start treating the trauma, helping them become safely embodied, and it doesn't feel very good at first, even though they're clearing stuff out, because there's more stuff to clear out. So we always say to them, this will not last at this intensity, right? Feeling is healing. This is a good shift. So really what I want to highlight is when we get in and we treat the underlying pain, we do see that shifts are possible. We see that people aren't needing those substances in the same way. They don't want or need them in the same way because it starts, I have one person that said this so well. She said to me, Lori, for the first time in my life, I like who I am and I feel comfortable being in my body. She said, so nothing can take that away from me. And yes, there are things that feel uncomfortable at times, but I know how to manage that now without drugs or alcohol or hurting myself or high risk behaviors. You know, I can take care of that and feel those feelings and move through it. That's an example of resiliency and healing, which is really cool. We help to address ambivalence with addictions because there's so much that gets hardwired in with that excitatory response where the illusion is, this is good, this is helpful, but really, you know, and I hear this so many times where people will share their stories and they're in tears about the devastation it has cost them. But a moment later, their subconscious is like having this sense of vitality and aliveness when they talk about using. That's the subconscious and the conscious not being present at the same time. Part of our role in therapy is to catch that and be curious about it and bring it to conscious and challenge that, right? What I hear you saying is, this has cost you so much. And I'm confused because when you talk about using, I just see this brightening and vitality coming over you. What's that about? What's the message you're sending yourself? Is it true, right? Is it real? We want to increase awareness of what's happening within them and around them. And sensory distraction is a really powerful tool for helping people to overcome cravings, paired with processing as well. And yeah, mindfulness awareness. And I'm going to read you a poem. It's a little bit hard to hear, but I think it really illustrates hard drugs. I don't know who the author is. It was circulated when I worked as an addictions counselor, and it's probably one of the most powerful things that I've heard, and very true. And I read this to many clients, and they just said, "You're speaking my life," right? So it's called Hard Drugs. I destroy homes, tear families apart, take your children, and that's just the start. I'm more costly than diamonds, more costly than gold. The sorrow I bring is a sight to behold. And if you need me, I'm easily found. I live all around you in schools and in town. I live with the rich, I live with the poor, I live down the street and maybe next door. My power is awesome. Try me, you'll see. But if you do, you may never break free. Just try me once and I might let you go, but try me twice and I'll own your soul. When I possess you, you'll steal and you'll lie. You'll do what you have to just to get high. The crimes you'll commit for my narcotic charms will be worth the pleasure you'll feel in your arms. You'll lie to your mother, you'll steal from your dad. When you see their tears, you should feel sad, but you'll forget your morals and how you were raised. I'll be your conscience, I'll teach you my ways. I take kids from parents and parents from kids. I turn people from God and separate them from friends. I'll take everything from you, your looks and your pride. I'll be with you always, right by your side. You'll give up everything, your family, your home, your friends, your money, and then you'll be alone. I'll take and I'll take till you have nothing more to give. When I'm finished with you, you'll be lucky to live. If you try me, be warned, this is no game. If given the chance, I will drive you insane. I'll ravish your body, I'll control your mind. I'll own you completely, your soul will be mine. The nightmares I'll give you while lying in bed, the voices you'll hear from inside of your head, the sweats and the shakes and the visions you see. I want you to know these are all gifts from me. But then it's too late and you'll know in your heart that you are mine and we shall not part. You'll regret that you tried me, they always do, but you came to me, not I to you. You knew this would happen, many times you were told, but you challenged my power and chose to be bold. You could have said no and just walked away. If you could do that day over, now what would you say? I'll be your master, you'll be my slave. I'll even go with you when you go to the grave. Now that you've met me, what will you do? Will you try me or not? It's all up to you. I can bring you more misery than words can tell. Come, take my hand. Let me lead you to heaven. It gives me shivers every time I read it, every time I read it. Such a powerful book, right? But that's for drugs. And it's a slippery slope. And again, the younger we are, the more potential there is, right? But I would never gamble with hard drugs ever at any age. So thank you for listening, and any questions that anybody has.